Hey everyone, it's Shannon, and today I'll be talking about Careful Devices, a design manifesto. So what is Careful Devices? Careful Devices is a design manifesto and/or research project designing humane approaches to bodily self-tracking and in-home healthcare technology. It aims to illustrate how technology is part of a practice of health that is apparent in personal experience and judgment rather than only medicalized definitions of sickness of disease. Currently, there is a growing interest in gathering health data through consumer technologies. Examples of data gathered range from sleep tracking to fertility tracking and more. Many individuals use these types of data for personal health reasons, self-motivation, and optimization, or even just curiosity. In addition, due to these data now being made readily available, in-home personal health tech and practices such as telemedicine and e-health are even more prevalent. However, one issue with the data is that even though people are able to see it, it is not the same as professionals helping them understand or interpret the data. My thoughts on Careful Devices is that I feel that it is a reasonable approach on health technology. I agree with how there are times where we are presented with health data, but sometimes do not know how to interpret nor understand it. For example, I have a friend who uses a fertility tracking app. However, she mainly uses it to track the arrival date of her menstrual cycle, despite the application giving her other information that pertain to her health. With a scenario such as that, I feel that there is a lot of data provided that is being lost. The goal of the Careful Devices design is to help users and patients become more reflective on their health data, and also to have the data act as a discussant in creating new doctor and patient relationships. Overall, I think it seems like a reasonable design research project.
Hi, my name is Jaren and I'll be talking about Careful Devices. Careful Devices have bridged the gap between the lived experience of a person and the abstracted medical knowledge of a health practitioner. They have also created a device that is reflective and create opportunities to share information that is usually unavailable. However, they ran into some challenges, and these challenges are that the people whose data is being measured is excluded from data gathering and data interpreting. My thoughts on this is that there are both pros and cons to self-tracking and home healthcare technology, but the pros definitely outweigh the cons. This makes things a lot more convenient, and I think it should be implemented in more aspects.
Hi, I'm Yuya, and I'm going to talk about the technology for the chronic health.
So all of us research is considered as a precision medicine, which requires a lot of time and it needs support from a wide range of health studies to fully benefit the program. And it is best to have more than 1 million participants, ideally, and the more the better. And it is different compared to the other program that was discussed in the past, since all of us research also connect the technology to technology and linking with other electronic health records. So the program will be hard to develop, but the result will be really good if the program can acquire long-term data from patients.
Hi, this is Anne. I'll continue to talk about All of Us research. All of Us is a new research program from the National Institute of Health. The goal is to advance precision medicine. Precision medicine is healthcare that is based on you as an individual, who takes into account factors such as where you live, what you do, and your family health history. Precision medicine's goal is to be able to tell people the best way to stay healthy. The program aims to make research results accessible to participants, developing new approaches to generate access and make data broadly available to approved researchers. What have we done? Participants enroll digitally through the All of Us website. Surveys are available in English and Spanish, and all the content for participants are targeted to a 5th grade reading level. All of Us program is storing data in a common cloud environment. Improved researchers will be able to use web-based tools, interactive cloud-based computing environments to explore data and test hypotheses. What are our thoughts? We think that they should enable research that provides an improved understanding of health and disease, support accurate diagnosis, rational disease prevention strategies, treatment selection, and development of targeted therapies, establishing authentic engagement with participants, and resist cyber attacks and effectively communicate with legal and procedural protections for privacy.
Hi everyone, my name is Livia Chumaki and I'm going to be talking about All of Us research program. I am very excited about the All of Us research program. I know that it will be very beneficial and will expand medicine to become more successful and effectual. I think this program should be expanded globally to be more inclusive. This research program can be expanded if more health organizations join All of Us and reach out to other countries to try to get more participants. They can also use advertisement through social media and general media to get people engaged. People are not the same, and their symptoms, genetics, and life experiences differ. Comparing Caucasian woman with an African American man might be very different, medically speaking. Comparing someone from a rich family versus a poor family might affect their health, and treating everyone the same medically can form bias and might not allow physicians to diagnose that patient as effectively. Looking at someone based on their family, where they came from, where their parents came from, where they grew up, race, socioeconomic level can help medical professionals understand that person and their symptoms better. When the treatments are customized to be unique for every individual patient, medicine can improve and people's quality of life can increase.